From everyone at ProQR, um, we wish you all a happy Usher Syndrome Awareness Day. My name is Naveed Shams, and I'm the Chief Scientific Officer here at ProQR Therapeutics. In this short video, we wanted to thank all of those members of the community that write to us every day and address some of the questions. I hope I can answer a few in this short video.
Hi, Naveed. So the first question that has come in from the community is, what is Usher syndrome?
Usher syndrome is a genetic condition characterized by both hearing loss, which can go all the way to deafness, and the progressive loss of vision, which can unfortunately also go all the way to blindness. The loss of vision is an eye disease commonly called retinitis pigmentosa, or RP in short. This affects the light-sensitive area of disease on the back of the eye, also known as the retina. There are three main types of Usher syndrome: type 1, type 2, and type 3. Each of these types has several different genes responsible for causing the syndrome.
Thank you, Naveed. The third question that has come in is, you mentioned genetics. Why does genetics play such a crucial role in ProQR science?
Usher syndrome is a genetic disease that is almost always passed down through the autosomal recessive pattern of inheritance. In this type of inheritance, the parents are carriers, unaffected by Usher syndrome. Each parent has one mutated Usher gene copy and one normal copy. Each of their children has a 25% risk of inheriting the two mutated Usher gene copies, one from each parent, which then causes Usher syndrome. USH2 is most caused by mutations or mistakes in the USH2A gene. This gene is responsible for the formation of the usherin protein. The mutation results in a lack of functional or working usherin protein and disrupts a process called phototransduction in the light detecting cells called rods and cones in the retina, causing retinitis pigmentosa. You can find out the possible gene causing your condition through genetic testing. This is a type of medical test that identifies what mutation causes a person's disease, or whether someone carries a mutation that can cause a disease. The results of a genetic test can confirm or rule out a suspected genetic condition, or help determine a person's chance of developing or passing on a genetic disease. This is fundamental to the science we are doing at ProQR.
Thank you, Naveed. Moving on, ProQR is researching in Usher syndrome. Can you tell us a little bit about QR421A and what it does?
QR421A is an investigational RNA therapy that aims to stop vision loss in people with retinitis pigmentosa and Usher syndrome due to mutations in a specific part of the USH2A gene called exon 13. QR421A works by binding to the mutated USH2A RNA and excluding exon 13 from the RNA. This approach is known as exon skipping. The cells in the retina can then produce a slightly shorter but functional USH2A protein.
Thanks, Naveed. So QR421A only focuses on the USH2A gene and specifically mutations in the exon 13. Does that mean it won't work if someone, say, has a mutation in exon 20? If not, why?
QR421A is very specific at focusing on binding to the mutated USH2A RNA and excluding exon 13. QR421A is just one of the first steps in the Usher research community, and we are immensely honored and humbled to be an industry leader in the Usher's field. We are looking forward to a successful development of 421A in clinical trials starting soon.
Thank you, Naveed. That's wonderful. And the last question from the community is, what is your hope for the future of Usher syndrome and wider IRD or inherited retinal disease research?
Thank you for that question. My hope and the hope of ProQR is that we and our technology is going to make a significant difference in slowing down the progression of vision loss in patients with a genetic defect that is causing this vision loss. Our hope also is that we can improve, not only stop, but also improve the quality of vision and therefore the quality of life of our patients in the not so distant future. And so we are doing our best in getting 421A into a clinical trial that will help us achieve this mission of providing a viable, safe, and very effective therapy to our patients with vision loss associated with Usher syndrome. It's a matter of time, we are quite sure, before viable therapies are available to our patients where none is available today.